So here's what we're going to do. We're going to bring her up to about 160 degrees. Easy, Emily. Okay, about 160 degrees of elevation. You can either put them in full flexion in a sagittal plane, or you can pull her out, pop into a scaption. Okay, I like scaption. It's one of my favorite things. It just is. I'm going to bend her elbow like this. It just gives me more control. I'm going to take this hand. I'm going to put it on her scapula. So I'm going to drive her arm down into here. So I'm just going to put a little bit of compressive force and just rotate. Ooh, nice. Ooh. Oh, beauty. There's a very clear positive sign here. Does it hurt?
I just feel it pop.
Oh, that's wonderful. I'm all a tingle. That's a positive sign. Okay? Because what I'm feeling is a lot of grating. So I start here and I get nothing. I come to here and pop. Okay? And then as I keep going, I get a little bit more there. There's a real clear arc of popping in there, of grating. That indicates that there's some labral issues in there. Some tears in there. That may be.
Hopefully.
Okay. So this is like an Apley's test when you do a grind, or the hip grind test, or those kinds of things. It's the same principle, right?
Is it unusual that she's not feeling significant amount of pain?
No, because remember we're talking about aneural structures in there for the most part. So the other thing that we can do, like I told you before, is I bring her into scaption, and I can actually go through a circumduction like this, and I get it there. You see, I can get the greater range of motion, so I'm just really grinding everything now. And it's there. So she's got an arc, posterolateral, on the labrum, where there's probably damage. Not probably, there is. Okay?
No, it was funny because as soon as you said she'd smile, and then, okay, it's there. And then you'd say, okay, right, and she'd smile, you could tell.
You can tell. I mean, I can feel it, and so, wow.
Do you remember doing any damage?
Probably from swimming.
Makes sense, right?
So is that a slap lesion?
It could be a slap lesion. Okay? Great. And we indicated overhead activities and traumatic injuries and things like that can lead to a slap. Dislocations can lead to a slap. All right, so that's a crank test. Questions on that one? Okay, what's the other one we want? AC shear test. Another oldie but goodie. Right? So we take our hands like this. We put the heel of this hand on the clavicle, the heel of this hand on the scapular spine. We interlace our fingers and we squeeze. Just like that.
A little bit.
Okay, where?
On the clavicle and then
Okay. So I'm compressing
kind
things
of
in
up
front.
there.
Because where should I get? What's a positive sign? Where's the right thing? Right up here in the AC joint. Okay. So and that can happen. You're compressing things and you've got little nerves in there, and that can ouch. Just readjust your hand position a little bit and do it again, because you're looking for the complaint of pain or the laxity in the structures that you're testing. Okay, and you've experienced that maybe before, where your hand grip is what caused the discomfort. That hurts. If that's how they say, you're interpreting as, oh, that's a positive sign, but in point of fact, it was bad technique. This technique needs to be adjusted. Right? AC shear. Question on that one? Okay. And then Adson's, is that the last one we got?
Yep.
So this one, like we said in class, the first thing I want to do is I'm going to be with the individual, I'm behind them, and I'm going to take the arm that I want to test, I'm going to find their radial pulse. So I have them just relax until I find their pulse. Okay? And then what I do is, I'm going to have her looking straight ahead, sitting up tall, and then I'm just going to come back like this. Okay? And I just keep coming back, and coming back, and coming back, and coming back. And I say to her, I want you to tell me, if anything happens, will I do this? Okay? I'm not real interested in trunk movement because I'm trying to distract things across the shoulder joint. So I get to about there and I'm good. And I don't feel any diminishing pulse and I don't get any complaints of pain for her, so I know that it is probably not minor, right? I'm good with that. So I go, okay, what's the next thing I want to do? Have her turn her head. I'm going to have her turn her head the opposite direction, like this. Keep my finger there and see if anything happens to the pulse. See if the complaint changes. Does it? Then I know it's not. What? Skinny links. Okay. Take a nice deep breath in. Hold it. 2, 3, 4, 5. Breathe out. Just breathe normally. In that 5-second period of time, I'm going to feel something change. I don't want her holding their breath too long. for obvious reasons. Okay? If, as she holds her breath for that few seconds, she starts to feel things, or I feel a diminishment of her pulse, then it is probably where it passes underneath the clavicle, right? In that interval between the rib and the clavicle. Okay? So that's, like we talked about in class, that's how we gather information from that one. If it's none of it provokes it, then I go to do like this Brody's test like this. While that's negative, then I have to go back and figure something else out, right? And so it is possible when you go through an entire battery of those tests, the person's had an MRI, they've had an X-ray, they've had exploratory surgery, and all of it is negative, it is possible that you're dealing with a psychogenic pain syndrome, which we'll talk about this summer. Yeah, different hammer for that one. Okay? Questions on that?